Now let's study about some of the important points about external ear and tympanic membrane. Important points about external ear and tympanic membrane. And temporal bone. So the first thing is pinna is made of an yellow elastic cartilage, which is known as auricular cartilage. And this auricular cartilage is present in the cartilaginous part of external auditory canal. Next is incisura terminalis is present between tragus and crus of hallux. At this part, no cartilage is present. It is devoid of cartilage. That's why if we have to reach external auditory canal, then we will give an incision through incisura terminalis. This is our crux of hallux and this is our tragus. In between these two, there is incisura terminalis. And this approach is known as end oral approach. And we know that lobule is also devoid of cartilage, and this is also the safest site of piercing. Okay, so now our next point is that our pinna is firmly adherent to skin at lateral surface. जो हमारे पिन्ना का लेटरल सरफेस है, लेटरल सरफेस मतलब कि जो साइड हमारी कहाँ पे फेस कर रही है, बैकवर्ड्स जो फेस कर रही है, यानी कि ईयर का जो पीछे का हिस्सा है वो जो होता है हमारा लेटरल सरफेस होता है. It is firmly adherent to the perichondrium. Now next is the length of external auditory canal is 24 mm. External auditory canal is divided in two parts, the outer part and the inner part. The outer part is made of cartilaginous part and the inner part is made of Bony part. Inner part is a inner bony part. This outer cartilaginous part is of 8 mm and the inner bony part is of 16 mm. Okay, so let's study external auditory canal in some more detail. That the cartilaginous part, it is also known as the lateral one-third part of the external auditory canal, and the bony part is known as medial two-third of the external auditory canal. The length we have written that it is 8 mm and it is 16 mm. Next is this cartilage is a auricular yellow elastic cartilage. And this bony part is the squamous part of temporal bone superiorly and mastoid part posteriorly. Now let's see the direction of the external auditory canal. The cartilaginous part direction is upward, backward, and medially. And that of bony part is downward, forward, and medially. Okay, the skin here, this is about the direction. The skin in the cartilaginous part is thick and the skin in bony part is thin. The skin contains, in the cartilaginous part there is presence of hair, ceruminous and pilosebaceous gland, and these glands produce wax. The deficiencies, which is important, the deficiencies which are present in the cartilaginous part is fissure of Santorini, and the deficiencies present in bony part is foramen of Huschke. Now from these direction, a question is made that in which direction the ear is pulled to do otoscopic examination. So we pull the ear in upward, backward, and lateral direction. On these deficiencies, there is a question that if a person has otitis externa, later he develops parotitis. From otitis externa, he develops parotitis. This is due to fissure of Santorini. Which is a deficiency that is present in canal, cartilaginous canal. Now next question is that the furuncles, there is presence of hair, then the furuncles will be present in the cartilaginous part of the external auditory canal. Next is the ceruminous glands. These ceruminous glands are the modified apocrine glands. Next is there is a narrowest part of external auditory canal, which is known as isthmus, and it is related 6 mm lateral to tympanic membrane, and it is very difficult to remove a foreign body if it will be impacted in the isthmus. So the isthmus is the narrowest part of the external auditory canal, which is 6 mm lateral to the tympanic membrane, and if there is any foreign body lodged here, then it is very difficult to remove this foreign body. Now, what is the appearance of tympanic membrane if we see it on a otoscopic examination? What is appearance of tympanic membrane on otoscopic examination? Then it will be appeared as pearly white or pearly gray on otoscopic examination if it is a healthy tympanic membrane. If there is any abnormality in the middle ear, then there will be color changes in the tympanic membrane. The tympanic membrane is formed from all the three germ layers that we know already, which is the following. And the other thing is that the tympanic membrane some important points about tympanic membrane, that its thickness is 0.1 mm. Its length is 9 to 10 mm. Its width is 8 to 9 mm. Its area is 90 mm square, and it make an angle 55 degree with horizontal. The tympanic membrane is not vertical. It makes an angle 55 degree with the horizontal. And the inner surface. Inner surface means the medial surface of tympanic membrane is convex, and the lateral surface is concave, and the most depressed part is at the concave is umbo. What is umbo? The umbo is where the lateral process of malleus is attached. The Sharpnel membrane. Sharpnel's membrane is an other name for pars flaccida. You know that tympanic membrane has two parts. pars flaccida and pars tensa. During an otoscopic examination, there is, when we see the tympanic membrane, then we see a cone of light, and this cone of light is present in the cone of light on tympanic membrane is seen in the antero-inferior quadrant. Okay. And now let's study about some nerves that supply our pinna. So first nerve is greater auricular nerve. This arises from cervical plexus C2 and C3, and the region supplied by it is the medial surface and the posterior part of lateral surface. Next is the lesser occipital nerve. The derivation is not so important, that from which it is derived. The nerve and their region supplied is important. So the lesser occipital nerve supply the superior portion of medial surface. The auricular branch, that is a branch of vagus nerve, that is 10th nerve, supplies the concha and antihelix and some part of the medial surface. Next is auriculotemporal nerve. Auriculotemporal nerve is a branch of mandibular nerve. Okay, it supplies the tragus, the crus of helix, and the adjacent helix. Next is the facial nerve, which is our 7th nerve. It supplies a small region of root of concha and retroauricular groove. So first we have to learn about the nerves that supply the ear, external ear. First is great auricular nerve, next is lesser occipital nerve, next is auricular branch of vagus nerve, next is auriculotemporal branch of mandibular nerve, and next is facial nerve. So total 5 nerve supplies our external ear. With diagrammatic representation, we can study that this is our medial surface of ear. Okay. So the auriculotemporal nerve. Auriculotemporal nerve supplies the tragus and crus of helix. So this are tragus and this is our crus of helix. This is our crus of helix. So this part is supplied by our auriculotemporal nerve. Auriculotemporal nerve, that is the branch of mandibular nerve. Next is the great auricular nerve, which supplies the our medial surface. So maximum part is supplied by our great auricular nerve. Next is are cranial nerve 7th and 10th. 7th and 10th. The 10th nerve supplies the concha, right? The concha and antihelix. And the facial nerve supplies also the small part of the concha, the root of the concha, and retroauricular groove. So this is about the medial surface. On the lateral surface, what are the structures? So let's consider that this is our lateral surface. On lateral surface, the cranial nerve 7th and 10th supplies the retroauricular groove. Okay, next is the great auricular nerve supplies the lateral surface also. Yeah, great auricular nerve. And our lesser occipital nerve supplies the superior portion of the medial surface. So this are lesser occipital nerve area. This is our greater auricular nerve. This is cranial nerve 7th and 10th. Okay, so this is all about the nerve supply of the pinna. Now let's do some important points. Let's see some important points that comes in our NEET PG questions. So the first thing is the major part of the nerve supply is by which nerve? So it is that we have seen that greater auricular nerve supplies the major part. The greater auricular nerve supplies major part of ear. Major part of our ear. Next is if a patient is having a numbness and tingling sensation at the upper part of the medial surface of the pinna, then that is due to lesser occipital nerve. It is mentioned that it is at the superior portion of the medial surface, and it is due to lesser occipital nerve. Next is if a patient coughs when removing excess cerumen from the ear. So our that a patient is coughing. Coughing is due to vagus nerve, and the branch of vagus nerve is auricular branch. So this will be due to auricular branch that during the coughing process the patient will be having when removing the excess wax from the ear there will be coughing reflex. This is due to auricular branch of the vagus nerve. What is Arnold's nerve? The auricular branch of the vagus nerve is known as Arnold's nerve or Elderman's nerve. Okay, next is which of the cranial nerve do not supply the tympanic membrane? टिम्पैनिक मेम्ब्रेन को कौन कौन सी नर्व जो है सप्लाई नहीं करती? तो हमने देखा, हमने एक्सटर्नल ईयर की तो हमने नर्व सप्लाई देख ली है. अब हम देखते हैं टिम्पैनिक मेम्ब्रेन की नर्व सप्लाई. नर्व सप्लाई ऑफ tympanic membrane. So we know that tympanic membrane की 3 layers हैं that we already know, and इसके 2 surface हैं, lateral surface and medial surface. अब जो हमारा medial surface है इसको जो supply करती है that is cranial number 11th की branch, that is tympanic branch, and this nerve is known as Jacobson's nerve. So हमारे lateral medial surface को हमारी Jacobson nerve supply करती है. अब आते हैं lateral surface पे. तो lateral surface के 2 part हैं जो अलग अलग supply होते हैं, anterior half and posterior half. तो हमारा जो एंटीरियर हाफ है वो सप्लाई होता है ओरिकुलो टेम्पोरल नर्व। अब ओरिकुलो टेम्पोरल नर्व जो है वो क्रेनियल नंबर ट्राइजेमिनल की थर्ड ब्रांच दैट इज मैंडिबुलर नर्व की ब्रांच है। एंड पोस्टीरियर हाफ इज सप्लाइड बाय आ वेगस नर्व। वेगस नर्व की ब्रांच को क्या कहते हैं? ऑरिकुलर branch of vagus, which is our cranial number 10th. So this is the nerve supply of the tympanic membrane. Lateral surface and medial surface की अलग अलग है। medial surface को cranial number 9th जो है that is our glossopharyngeal nerve की branch है। tympanic branch जिसको हम बोलते हैं जैकोब्सन nerve। and lateral surface को हमारी supply करती हैं मैंडिबुलर नर्व की ब्रांच दैट इज ऑरिकुलर टेम्पोरल नर्व एंड वेगस नर्व की ब्रांच दैट इज ऑरिकुलर ब्रांच ऑफ वेगस सप्लाई करते हैं। नाउ अब ऐसे होता है कि जैसे किसी का एक्सीडेंट हुआ, रोड ट्रैफिक एक्सीडेंट, एंड उसके दौरान उसके ईयर से ब्लीडिंग आ रही है, उसका ईयर जो है वो ब्लीड कर रहा है। सो व्हाट वुड बी द कॉज? The cause will be that there is a temporal bone fracture. Okay. Because as we know that our ear is related to the temporal bone, so our temporal bone during accident, if there is any bleeding from the ear, that will be due to temporal bone fracture. Now let's see the relations of external auditory canal. Our external auditory canal have four boundaries, that is superior, inferior, interior and posterior. Okay, so let's assume that it is a rectangle which is having a superior margin, the inferior margin, the interior, and the posterior. Okay, so the superior margin is formed by a middle cranial fossa. The inferior margin is made from the parotid gland. The interior margin is formed from the temporomandibular joint. Temporomandibular joint. And the posterior part is made from the mastoid ear cells and our facial nerve. So let's study. The superior is formed from the middle cranial fossa. In the upper part of the external auditory canal, the middle cranial fossa is present, and above that, the brain is present. In the inferior part, the parotid gland is present. The parotid gland is present. In the anterior part, temporomandibular joint is present. Okay, temporomandibular joint is present, and behind it, the mastoid ear cell is present. And this is a styloid process. And here is the temporofacial nerve passes beneath the mastoid. So posteriorly, mastoid ear cell and facial nerve is present. The next is if there is cuffing on scratching the external acoustic canal, then it is due to the auricular branch of the vagus. So this is all about the important points of the external ear, the nerve supply of the external ear, the fracture of the temporal bone, and the boundaries of the external auditory canal, and some more details about the external auditory canal, the nerve supply of the tympanic membrane, the surfaces of the tympanic membrane. So these are the important points from which the NEET PG questions can be made. So please study it in detail. Thank you so much for watching this video. Hope you enjoyed this video. And this video is making some changes of how you attempt a question. So thank you so much. Keep sharing and subscribe my channel for having more such videos like these. Thank you so much.